Our next guest helps his clients make some of life's most important decisions. Brett Frankenberg is a board-certified patient advocate who draws on years of experience in the healthcare industry and now provides expert guidance to families who are making complex care decisions. The following segment is brought to you by Apex Health Advocates. So Brett, thanks for coming in today. A pleasure to talk to you. I guess the logical place to start is by telling us, what is a patient advocate?
Yeah, Roy, thanks. It's a pleasure to be here. A patient advocate is a professional who works with individuals and families to help them navigate the healthcare system, translating medical jargon, coordinating care, and helping them to understand the decisions that they're facing. So at Apex Health Advocates, we act as translators, we act as strategists and advisors as well. It's really important that our clients are making informed decisions, that their voices are heard, and that we're also making sure that any care transition is well coordinated. So our goal is relatively simple. We're there to save families time, stress, and money while restoring peace of mind. I like to say we're the panic button when the crisis strikes, and we're the compass for long-term planning and recovery.
Right, and we're going to talk about the importance of having your information at hand when you need it.
That's exactly right.
Who is it that's going to need a patient advocate? What's the profile?
You know, clients come to us really there's two main types of clients, I guess I would say. One does find us in crisis, so it could be a hospitalization or an injury, or maybe it's a major medical decision or a new diagnosis. But there are plenty of people that come to us too that see the value in planning ahead before that crisis occurs. One crisis such situation I handled was an individual who was in a horrific snowboarding accident in another state. I was able to coordinate his medical evacuation back to San Diego, his hospitalization, his rehab, even an emergency surgery in the middle of his recovery. And then we were able to get him home with home health. We got him to outpatient, and well on his way to recovery, and his family just had to worry about him. I took care of all the logistics.
Wow, that's so nice. And a lot of steps in that particular scenario that you spell out. And at the beginning of this, in a time of crisis, it's so important that people take note of your information and have that at hand, right?
That's right.
Okay, so important that you do that, right? So where does advocacy typically take place?
Everywhere care happens. It happens, advocacy happens in the hospital, in the rehab center, in the assisted living center, even at home. For that matter, we do work virtually. In fact, I helped two sisters here in California navigate their mom's stroke in Pennsylvania. They were overwhelmed. They were overwhelmed by the distance, by the choices, the right rehab situation, and even the right living situation. I was able to step in, I was able to keep everybody aligned, and I was able to make sure that those decisions were well informed. And Roy, that is advocacy in action.
Absolutely. So important for the patients and for the families.
Absolutely.
Dealing with this in such a time of crisis. So what do you suppose separates Apex Health Advocacy from other companies in the field?
For me, it's experience and perspective. I have over 30 years of experience as both a healthcare clinician and a healthcare leader. I'm also a board-certified patient advocate, and that is actually a nationally recognized credential that has professional education standards as well as ethical standards. And so I really understand how care should happen from the inside, and my job is to make sure that that care is happening for my clients and their families as well.
Lots of industry experience to understand who it is that you're dealing with when families just don't.
That's exactly right. And I mean, I can tell you all kinds of stories about clients that I've worked with, and I'm sure we'll get to some of those.
Right. Okay, so what is the consultation process? Do we set up a meeting with you? Is it online? And again, I can't stress enough the importance of keeping that information handy at the time that you need it. But walk us through your process.
Yeah, the process is really simple. The best way to get in touch with us is to visit us at our website, which is apexhealthadvocates.com. And there you'll find a free library of resources, planning guides. There's even the opportunity to book a complimentary 30-minute discovery call. And really, you could also chat with our virtual assistant and get all kinds of different resources. But at the end of the day, we're really here, whether you're in crisis or you're looking to plan for the long term. We're here to really guide you through life's most critical care decisions with confidence.
The preparation, the anticipation, that's paramount.
That's right.
Have people visit your website for more information to get started, right?
That's right.
Okay. Thanks so much for your time. Appreciate the information.
Thank you, Roy. Appreciate it.